I'm Emily. I'm a student at the Livonia Career Technical Center, and I'm going to tell you how to do a basic examination of the ear. Information that you would need to obtain from the patient of their medical history would be symptoms of their ear disease, such as deafness, discharge, pain, or vertigo, previous head injury or ear surgery, family history of deafness or disorders, and history of systemic diseases such as stroke, MS, cardiovascular disease, and exposure to loud noises such as shooting. Before using the otoscope to observe the eardrum, you need to observe the ear as a whole, and you're going to look at the ear and see if there's any signs of disease that would link to the patient's symptoms. After observing the ear, you're going to look at the external auditory canal. You're going to start by pulling the patient's ear gently up and out to see the whole ear canal. It should be a pinkish color, the color like your skin. After you observe the external auditory canal, you're going to begin to observe the eardrum. You'll use an otoscope, which you need to clean with an alcohol pad. You clean the part that would go into the patient's ear. And then you pull the ear up and out gently and look in with the light in the otoscope. The eardrum should be a circle shape and it should be pink or gray in color. If it's red or yellow and it's opaque and bulging, then you may have an infection in the middle ear, which is known as acute otitis media. If in extreme cases of acute otitis media, the eardrum was going to burst, which will let go of the pain and the pressure. Your otoscope may be able to puff a small amount of air into the canal to see how much your eardrum moves with the pressure. This is known as insufflation. Normal air pressure of the middle ear should equal out to the outer ear. It allows your eardrum to respond to the sound of vibration. There's a tube in your ear that goes to the middle ear to the high back part of the throat, which cannot be seen by ordinary inspection. If there's a blockage in the tube, the patient could be suffering from a cold. If air can't get to the middle and equalize itself, it can cause impaired hearing or extreme pain. An ear conduction test is a basic test of seeing how well the person can hear. The fluid in your cochlea moves due to vibrations. The cilia, which are little hairs inside, will then start to move. The movement will turn into electrical signals, which are then transmitted into nerve cells in your body. Normal findings of the test is that you can hear well. Abnormalities will indicate an air gap or bone gap, which is found through the ear conduction test. An audiogram is part of like a routine exam when you go to the doctor if they suspect loss of hearing. The test works by having a set of the tone headphones on. The patient faces away from the doctor. The machine is set to 25 decibels, which is a normal hearing range, and is put on 20 hertz, which is an extremely low tone, and then up to 1,000 hertz, which is a high tone. The higher the hertz, the higher the tone. If your patient has between 0 and 20 decibels of hearing, that's normal hearing. Between 30 and 45, you have mild hearing loss. 45 to 55 is moderate hearing loss. 55 to 70 is moderately severe hearing loss. 70 to 90 is severe hearing loss, and 90 decibels and higher is profound hearing loss, which is going to require a hearing aid. Tympanometry is a test that changes the pressure in your ear to see how much your eardrum will move back and forth. It's done by a probe device being put in the canal of the ear. It plays loud tones and takes measurements based on the amount of movement from your eardrum. It's ordered so doctors can diagnose problems with the middle ear, such as fluid in the ear, otitis media, a perforation in the eardrum, or a problem with the eustachian tube. Normal results of the pressure in the ear would be between 50 and negative 150 decipascals. Abnormal results would be numbers beyond or lower than that range. The Dix-Hallopike test is ordered to find the cause of vertigo. Vertigo is the feeling that your surroundings are moving but there's no movement. The doctor will look for involuntary eye movement. Central vertigo is one of the two types. It's caused by a problem in the brain. Peripheral vertigo is caused by a problem with the inner ear or nerve leaving the inner ear. The doctor will have you sit on a table with your legs extended. The doctor will quickly move your head to one side and then lie you down with your head over the edge of the table. Once you recover, the procedure is repeated in the other direction. Normal results, you won't have any abnormal eye movement. Abnormal results would be that you had involuntary eye movement during the test and you are more likely extremely nauseous and you'll probably throw up after the test due to vertigo.